Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems Better Care podcast. And I'm here today with Ellen Matloff. She is a certified genetic counselor, patient advocate, and founder and CEO of Gene Counsel, which is a company revolutionizing digital genetic counseling for consumers and clinicians alike. Welcome to the show today, Ellen.
Thanks for having me, John. Pleasure to be here.
Absolutely. And just to start us off, would you mind telling us a bit more about your background?
Sure. I am trained as a genetic counselor. I spent my first 2 years out of graduate school in pediatric and adult genetics before being recruited to Yale School of Medicine to start the first program in cancer genetic counseling and testing. And I ran that program for 18 years before seeing some opportunities, let's say, in the field. And that's when I left to start Gene Counsel.
Excellent. And then what does a genetic counselor do, in every day in your role? And why is that important in today's market in 2025?
So I will say that when I started in the field, genetic counselors really only did a handful of things. And now genetic counselors do hundreds of different things. But a traditional old school genetic counselor definition would be a healthcare provider who meets with patients and their families, certainly in cancer, but also prenatal, pediatric, rare disease, cardiac, almost any area of medicine, pregnant couples, pre-pregnant couples, to talk about their risks, their options for testing, their test results, what those results mean for them, what it means for their family members, their children, their future children, to really help them manage their risks, understand their risks and their options, and really optimize health.
That sounds like it's definitely a comprehensive experience. You really dive into their history, I'm sure.
Absolutely.
And then which patients specifically, and like which clinicians and health systems are impacted by genetic counseling and testing?
Great question. So I would say because genetics is so pervasive, touching almost every area of medicine, that genetics is really touching almost every department, every health system, every patient. And we're really getting to the point where even prevention genetics and preventative care for healthy people based on their family history and based on what genetic mutations they carry, that's the future. It's going to touch all of us.
Yeah, absolutely, for sure. And then do you mind kind of diving more in kind of like your business model and the patients that you serve?
Absolutely. So when I was at Yale, when I first started there and started the program there in 1995, really it was only a tiny subset of patients who had cancer who were candidates for genetic testing. And those were usually patients who either had cancer themselves at a very young age. Usually for breast cancer, it was less than 35 years of age, and then had an extensive family history of cancer. So often it was like 2 or 3 first and second degree relatives with the same cancer, also diagnosed at early ages. So it was really restrictive. And since that period of time, it's grown and grown and grown to include more and more people. So using cancer as an example, imagine you're an oncologist and you're trying to get a family history on every single patient who comes through the door. And that family history doesn't just include the patient, but their brothers, their sisters, their mother and father, their aunts, their uncles, their cousins and grandparents. Just looking at that extended family history and then determining if they're a candidate for any genetic testing, that could take up your whole session.
Yeah, absolutely.
If you're a busy oncologist, you don't have time for that. You don't have time to determine what their family history is, if they're a candidate for guidelines. Guidelines update all the time. Tell the patient the pros and cons of genetic testing and why they may or may not want to consider it. And now you can magnify that to gynecologists and to primary care physicians, to cardiologists, and every single area of medicine. They'd really need to take that detailed family history to see if any testing is appropriate, and then tell them about the testing, do the testing, and then explain the results to them on that day and over time. Those are the pain points that Gene Counsel with our digital tools can help those offices and health systems level out.
Yeah, probably sort through all that information because it sounds like there's a lot of it and make sense of it for them probably through like some kind of summary format. Is that correct?
Absolutely. And it's not just collecting the information and analyzing the information and making sense of it, but it's also keeping on top of the latest guidelines and using algorithms that are specific to those guidelines to see if that patient's a candidate.
Help. And then getting kind of like bigger picture industry questions like what's one shift in your industry that you think like most fund founders or operators are underestimating, in your niche?
I think it's whether or not you need to keep in touch with the patient over time and maintain long-term engagement. In the past in medicine, we've kind of felt like you're only seeing the patient in that moment and maybe for follow-up appointments, but in genetics, not so much. In genetics, it was, we'll talk to you about this testing, we'll order the testing and tell you the results, and then we're done. But now the long-term engagement, updating patients over time, letting them know that new genes are available, letting them know that the meaning of their test results has changed is definitely part of the process. And I would say that the industry has not yet completely caught up with that and figured out how they're going to scale that.
Okay, yeah. So they're kind of behind the times, if you will, of like what's the new innovative way to think about it. It is like it's not just like a one and done type of lens. You really have to look at the longevity of this for patients because patients themselves are looking for like a complete picture and continued care, right? They want to have that experience too. So I can see why that would be really meaningful as well.
Correct.
And then how is the industry adapting to this innovative idea of, this continuum of patient care? Are they adapting to it? Or are they kind of, no, I don't really want to get involved with that? Like what's been your experience?
So, what I'm finding is that within the last year, I think systems are realizing, oh, we are going to have to keep in touch, not only with the patients that we see today, but the patients that we've seen in the last 5, 10, 20 years, we've never reached out to again.
Yeah.
How do we re engage them and keep them updated over time? And how are we going to do this in a scalable manner that doesn't really mean genetic counselors calling people on the phone?
Yeah.
Because that had been the method of choice and it's just not doable. Absolutely. And it's not just genetics. So healthcare systems, of course, want to do this because it's the right thing for the patient and
Yeah.
the right thing for the patient's family members. But it also brings that patient back to them for things like high risk surveillance, all of your imaging, any kind of preventative surgeries you might need, follow up. So, in terms of the return on investment, you can see why it makes sense to engage the patient and their family members over their lifetime.
Yeah, absolutely. And it's good for the patient, but it's also good for the health people providing the healthcare because the more preventative you can be about it, catching things proactively. Whereas I think the traditional mindset of medicine is more of a reactionary. It's like we see a problem, so let's fix that thing right now, but it's not really fixing the source of the problem or being proactive about reach out. So yeah, that's definitely disruptive to the market for sure. I'm sure from what you've probably experienced so far.
It is disruptive, and I think that genetics in general is disruptive. But if you're looking forward at using genetics and some of the newer surveillance technologies that are more targeted and that are using, cell-free DNA that's running through your body so that we can detect cancers at an earlier, more treatable stage. And it's not just, as I mentioned, it's just not cancer. This applies to cardiac genetics, prenatal genetics, pediatric and adult, and rare disease. It's really being able to get there before you're just reacting, as you mentioned, that
Yeah.
makes the most sense.
Yeah, absolutely. And then what are you specifically doing at my Gene Counsel to be more proactive or do those outreaches to re-engage with the patient? What are some things that you're doing right now?
Our product is called a living lab report. And when a patient is issued a living lab report based on the genetic testing they've had so far, whenever the guidelines update for the gene or the mutation found in your DNA, you get a ping. So you get an email or a text or a message through your electronic medical record so that you, as the patient, know that whenever there's something important happening, you're not going to wait 10 months until you see your primary care physician and hope that they'll remember to bring it up and have time to bring it up, it will come to you. And that's what we're really doing to keep the patients in the driver's seat and to keep them in the loop.
Like, what are the pain points in your operations that you're experiencing today?
So there are always barriers. I mean, one of the barriers is convincing the system that they need these services and need this long-term engagement for patients. But once they've realized that, it's also, do you want to operate on our platform or do you want to integrate into your EMR? And if they want to integrate into their EMR, we say, great, we're ready to go tomorrow. But sometimes at their own health system, they have to get in line for any EMR integration, and sometimes those lines can be between 10 months and 2 years in length just for them to get in line at their own institution.
Hmm. Yeah.
So that can be challenging.
Yeah, absolutely. Trying to get in what's usually a very complicated system, right? Trying to find your point of entry to get your word out and get that visibility that you're looking for. Absolutely.
In many cases, we start on our platform because we can get that up and running immediately, and then they can really work with the system, work out the kinks internally, and then over time, they can integrate it into their EMR. And that seems to be a pretty good method.
Excellent. Okay. So you've encountered this bottleneck, but you're finding alternative solutions to kind of get in, which is great. And then like kind of looking at like results and continuing with the bottlenecks discussion, like what's working really well right now, and then the alternative, what's been harder than expected.
I'd say what's working really well right now is that the patient gets a living lab report and the clinician gets a living lab report. And you can imagine how those reports are similar and how they're different. And we're finding that that really meets the needs of patients and of clinicians. I would say that what is difficult and what we're still working on is getting it into the workflow of health systems. And as I mentioned, convincing them that they need to offer a full family history to every single patient, why that's important, and convincing them that sending out a packet of information in the mail that's a 50-page long family history questionnaire that they've been doing that for 20 years and they want to keep doing it, that it's time to switch to a digital solution for a lot of reasons.
Yeah, absolutely. Just like the most obvious is like paper waste because they're huge packets, right? Just you can digitize those things, which makes a lot of sense. And just trying to get them to convince them to take a different approach, think more innovatively about it, which is definitely understandable from your perspective. Is then through these conversations, is there like a light bulb that comes on at a certain moment when you finally get through to them in the conversation? I'm curious to hear more about that.
Yes, I'm thinking of one recent customer that really had a hard time letting go of the 50-page paper questionnaire. And we went through the costs of that. Like, what's the cost of the paper? What's the cost of the printing? What's the cost of mailing it to the patient with a return self-addressed stamped envelope? And then the cost of your time to call them when they haven't returned it or they've only filled part of it out. And we just like looked at the costs and the amount of money involved. And the thing that they kept trying to say was that a lot of their patients aren't on don't have a smartphone or email. And what we've been able to see from national statistics is that most people do have access to a smartphone and or email, but they needed to see it and see that their patients could figure it out and that they wanted that and it worked for them. And it really took the seeing is believing.
Yeah, that's a really good approach, is like really breaking it down, like literally by the penny of like, this is what you're paying today, showing them the true ROI of what their current process is to basically come to their own conclusion. Oh, maybe this is not a great idea. Right. So, yeah, I like that. I really like that approach.
Well, you can imagine as a user, right? So you're the patient getting this packet of paper in the mail that you have to sit down and go through, and it takes forever to write it all out. And most of us just aren't used to doing that anymore, right? We're used
Yeah.
to having like a digital solution.
Absolutely. And then from the My Gene Counsel, there's specific like KPIs or metrics that you're measuring for success, or like maybe something is trending in the wrong direction, or other things you're really trying to keep tabs on.
Yes, we look at a lot of things, but mostly we're looking at, can we change the percentage of eligible patients who are having testing, and we've been able to change it by about 71%.
Wow, that's pretty significant. Wow, it's
It's
amazing.
significant. And part of the reason it's so significant is that people just weren't taking the detailed family histories and comparing it to the latest national guidelines and having the time to talk to the patient about whether they, were a candidate.
No worries. And that makes sense. Is that you're trying to look at the current status of where things are at, but also that's a huge. Do you mind expanding that a bit more of like the 70%, how you're able to achieve that? I'm curious, like how you're able to do that, because that's not like 7%. That's huge. Definitely interested to hear more.
Yeah, what we were able to do is have the health system go back 1 year
Hmm.
before we started working with them
Yeah.
and look at how many patients were diagnosed with different types of cancers and what percentage of those patients pursued testing, and then compare it 1 year out after they started using my Gene Counsel to the same metrics. And that's how we were able to achieve it. You really have to look at the pre and the post.
Bring the post and get the comparison. Gotcha.
Exactly.
Okay. And are there any metrics? This is like the good metric, but are there any metrics that are like stuck or like not really moving the needle at all right now that you're trying to figure out?
I mean, there are plenty of things that we're still trying to figure out, right? That's the
Yeah.
nature of it, always trying to figure out something. We have been able to also reduce time to test. So if a patient is diagnosed, let's say with prostate cancer, how many weeks does it take them to get that test? We've been able to shorten that window, which becomes really important if there's a precision medicine that they would be a candidate for, because you don't want them to get something else and then they can't get the precision medicine. I would say, like, some of the metrics that are more challenging are on the clinician side. Like, you get the clinician to use this tool and to log in and to even, fill out a short survey saying whether this was helpful to them. That's more challenging. And as a clinician myself, I can see why it's more challenging. Like, you don't want to fill out one more thing. You just don't.
Yeah.
So that's a challenge.
Yeah. But I assume through the process always like it is like another thing, but it's actually like a very valuable tool once you're able to show the metrics and the return. It's actually be a very, very proactive approach. That's what you're proposing.
Absolutely.
Yeah.
But, I just got off a phone call where a physician on the phone call said something like, well, I think you're going to find that we're testing almost 100% of patients who are candidates. And I didn't say anything, but probably they are not. I mean, if they are in line with national statistics, they are not testing almost 100% of people who are candidates. They just think they are.
Yeah. It's reality over perception. Right. Yeah. Yep. Absolutely. And let's say you solve all your biggest blockers right now. Like, what does success look like in 6 to 12 months?
For the company, you mean?
Yeah. Sorry for the company. Yeah. Sorry. Yeah.
I would say in 6 to 12 months, we're currently speaking to 2 national partners who could bring the solution into large networks that
Hmm.
would trickle down to community oncology centers. And that's where 80% of cancer care occurs, is in community oncology centers, not the really big names that you hear about all the time. I think that would be success if we could give these tools to the hardworking community clinicians who don't have 3 to 10 to 15 genetic counselors at their disposal and who really need help with germline testing, somatic testing, biomarker testing. That would be success.
Yeah, absolutely. And that's a good insight too, is like, I think that the general population always thinks about the big, research hospitals, but they don't consider like the community hospitals where probably, like you said, most of the care is taking place. So that's a good recognition to call out. So thank you for that. And then like, what's something like, we talked about like the long term. Is there anything soon that the My Gene Council needs to figure out now to tackle? Is there like working with these community, health centers or hospital? Are there very specific issues that they're trying to resolve?
I think it tends to be connectivity. It's convincing them that rather than immediately starting with your EMR, if you start on our platform, we can build up to your EMR But connectivity has become such a major issue in healthcare that people think everything immediately has to be in my electronic medical record or it won't work. So it's trying to convince them that we can start in a different way that's more nimble, work up to the EMR.
Yeah. And that's a good, coming from the IT background that I have, that's a good place to start from, because I'm sure you realized in especially EHRs, there's a lot of regulation, and trying to get approvals and work through that process to become integrated is a whole nother beast in itself, unfortunately. So, but I think your proposal, let's pilot it outside, you know, let's prove, and I know it does work, but let's prove it for your providers that this is a really essential tool for them. So yeah, I like that. I really love that approach. As we get into the end here too, where can people find you if they want to connect and learn about more about the My Gene Counsel?
So they can come to our website at mygenecounsel.com. We also have a presence on all of the social media platforms: LinkedIn, Instagram, Facebook, X, as well as Blue Sky. So they can find us there. And we tend to do B2B rather than business to customer. So it's really businesses and stakeholders who come to us, whether they're healthcare systems or pharma partners who come to us, or it can even be research studies, population health studies. We work with all of those primaries.
Interesting. So there's multi different channels that you can work with. So that's wonderful. And you mentioned LinkedIn. Is it okay for them to connect on LinkedIn as well with you?
Absolutely.
Wonderful. Well, thank you for your time today. I really appreciate it, and had a really deep dive discussion and had a great time today. So thank you so much.
Thank you for having me, John. It's been a pleasure.
You as well. Thank you.